You know that feeling when you're trying to deal with the healthcare system? That feeling of being totally lost, like you're stuck in some kind of maze with no map? Well, today we're going to dive into a landmark report from back in 2001 that looked at that exact feeling, figured out what was wrong, and laid out this incredibly bold vision for what American healthcare could be. It's called Crossing the Quality Chasm. And wow, its findings feel just as important now as they did back then.
And hey, that feeling of frustration, it's really not new. I mean, check this out. Even back in 1996, a big survey found patients calling the system a nightmare to navigate. It just felt less like a system and more like, well, a mess. This shared feeling is really what set the stage for a major investigation.
And that investigation led right here to the Crossing the Quality Chasm report, our source material for today. Now, its core idea was, honestly, revolutionary at the time. It shifted the blame. It said, look, this isn't about bad doctors or nurses who don't care. The problem is a fundamentally broken system that basically sets good people up to fail. To really get what a broken system feels like, the report used these powerful, true-to-life stories. So let's start with one of them. Let's talk about the story of a patient they called Mrs. Martinez.
So Miss Martinez is in her early 50s. She's a working mom, just moved to a new town. You can picture it, right? She's juggling a new job, a new place to live, getting her kids settled, and she's just trying to get her family hooked up with a new doctor. Sound familiar?
Yeah, I thought so.
So what's her first roadblock? She finally calls a primary care office that's taking new patients, and they tell her the first available appointment is 2 months away. 2 months just to get in the door, all while she's hoping her blood pressure medication doesn't run out. Okay, so when she finally gets a mammogram, the staff asks her to get her old medical records sent over. But you know how it is, in the shuffle between different offices and incompatible systems, they just never arrive. And with everything else going on, she forgets to follow up. A critical piece of her medical history, poof, it's just gone.
And then she gets the call. The mammogram was abnormal. She needs to see a surgeon for a biopsy. She calls to make an appointment. The first opening? 9 weeks later. For 9 long weeks, she's just left alone with this crushing anxiety, not sleeping, wondering what's going to happen to her kids.
So the report breaks this down, and it wasn't just one thing that went wrong. The system failed her on literally every single level. It was unsafe. Turns out a previous abnormal result had been missed. It was ineffective, leading to preventable harm. It was so not timely, we're talking months of delays. It was nowhere near patient-centered. Her very real fear was totally ignored. And of course, it was wildly inefficient. Treating cancer at a later stage is way more complex and expensive.
And here's the kicker. Ms. Martinez had good insurance. She was seen by well-trained people. But the system itself, the way information moved or didn't move, the way appointments were scheduled, how care was coordinated, it was just fundamentally broken.
Okay, so if the system is the problem, how in the world do you fix it? Well, the report didn't just point fingers, it actually built a bridge to a better future. It came up with 6 clear, powerful goals for what a 21st century health system ought to look like.
And here they are. These are the 6 aims that became the new blueprint for quality. It's basically the exact opposite of what Ms. Martinez went through. The report said care must be safe, avoiding harm. It's got to be effective, based on real science. It has to be patient-centered, to actually acknowledge her fear and her values. It needs to be timely, to get rid of those agonizing waits. It should be efficient, avoiding waste. And it must be equitable, making sure everyone gets the same quality of care. You can see how this isn't just some vague wish list, right? It's a concrete checklist for what good actually looks like.
Then the report did something brilliant. To make these goals feel real, it showed us what this new system would actually be like for a patient. So let's meet Maureen Waters and see her vision of a system that actually works.
And wow, the difference between these two journeys is just night and day. Where Miss Martinez waited for months, Maureen schedules an appointment online for the very next day. Where critical information was lost, here, digital records are shared instantly. And the result of all this isn't just convenience, it's a life-changing medical outcome. Her cancer is found at an early, much more treatable stage. The report's point is that this isn't science fiction. This is what happens when you intentionally design a system around the patient.
So how do you get from Miss Martinez's reality to Maureen Waters' vision? The report said you have to fundamentally rewrite the rules of how the game is played. This brings us to one of the most powerful new rules, making the patient the source of control. This means the system has to give patients the info and the opportunity to be as involved as they choose to be in their own care. It's a huge shift in power, moving it from the institution to the individual.
And this goes hand in hand with the second rule. Knowledge is shared freely. Patients should have total access to their own medical records and to the best scientific knowledge out there. No more asking for permission to see your own lab results. The idea is that information should flow freely to empower everyone.
So you see, these weren't just suggestions for little improvements. By putting the patient in control, demanding transparency, and totally redesigning the flow of care, this report was laying out a blueprint for a complete revolution in American healthcare.
And this blueprint for a revolution, this incredibly clear diagnosis, and this hopeful vision was written in 2001.
Which brings us to our final thought. Reading the stories of Ms. Martinez and Maureen Waters right now, which one feels more familiar to you? This report laid out the path to cross that quality chasm over 2 decades ago, and it leaves us with a really important question to think about. How wide is that chasm today?